Foam rolling is really effective for a lot of biomechanical issues, but certainly for knee pain, we can really get after those leg muscles and the fascia that surround them to help loosen things up, bring blood flow, and bring healing and hopefully better movement and better than strength training and more balance to the lower extremities. And that really includes the hip and the legs. So we're going to get after three places you can roll that might help bring more balance to the lower extremities and therefore reduce knee pain. There is something to consider though. There's a lot of versions of rollers out there, different firmnesses and textures. For most people just starting out, a foam roller that gives a little bit, this open cell foam is effective, yet maybe not quite so tough on the fascia and the muscles. So give this a try if you're just starting out. I do like the length of the longer versions here because they're more versatile, but try this. There's also firmer rollers out there that as you kind of progress into it and get more experienced at rolling that are maybe even more effective. So just a tip out there to choose the roller wisely. We're going to start with the white one today and show you how you can roll three areas. And I'm going to start up here in the hip. The tensor fasciae latae is really often quite tight. If you sit a lot, that can often then lead to knee pain because what happens in the hips affects the lower chain. So we're going to get into that area by having you facing the floor, getting the roller directly under that hip area, and it doesn't take too much movement to affect that area. It's going to be right below the hip bone and kind of in that hip crease almost, and you just want to get your body pressure on it and then just gently, slowly roll through that area. And if there is a tender or a tighter spot you find through the movement, maybe just isolate that and do some gentle little pulses. Staying with the line of the muscle is one method to roll, but then you can also do cross fiber rolling to really get that fascia loosened up and blood flow brought to that area. That's going to help it move better. So there's the hip, and make sure you do both sides evenly, even if you only have knee pain on one side. We want to work evenly in our extremities and our hips. And then we're going to go right into the quads. So the quads are called the quads because there's four muscle heads that come out, or muscle bellies that come out of that hip and down into the knee. And we want to affect all of those, but definitely start on maybe the outside. That often gets very tight. And so we want to almost be laid over on the side, on the lateral part of the leg, getting near the IT band. But then we've got a lot larger area to roll, but just take your time rolling from the hip down towards the knee, but avoiding the bony parts because we want to get into the fascia and the soft tissues, not the bones. And then again, you might find a sensitive spot that needs some more attention, then you just take your time rolling over that area. About 10 to 15 rolls is usually adequate. And then just move through the bellies of the muscles on the quads and find where maybe your real tightnesses are, and then that's probably going to help, again, bring better movement in the quads. And then to even that out, we want to work on the biceps femoris and what we call the hamstrings to help loosen that area up and again bring some attention there. Hamstrings are often very tight in people who have back and knee issues, so we want to address that by again getting your body weight onto the roller above the knee, back of the knee, up to the glute area. And we just want to again take our time keeping now both legs starting out on the roller, but then you want to isolate one leg at a time by either crossing your leg or just bringing the leg up and really getting as much weight into that rolling as you can to get the most effect. And again, finding those tight spots, and then you can even again do cross fiber rolling where you roll back and forth on those more tender spots. And I guarantee you when you diligently roll out your hip and leg areas, that's going to really start affecting your knee and bringing some balance there. So give foam rolling a try. Daily is fine because it's just like stretching out the muscles, giving yourself a massage, and you're going to get more effect that way. So I encourage you to try foam rolling for knee pain.